Hey everyone, our participant counter is ticking up. We're going to start our We've Got Your Back webinar shortly. We're just going to leave a little more time for some more people to join. We'll be right back with you in a few minutes. Good afternoon, everyone. My name is David Block, physical therapist and regional director at Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those who are joining us for the first time. Thank you all for choosing to spend the next hour or so with us. We know there are many bigger things going on in the world right now, and we appreciate you taking the time out of your day to spend some time with us. For those of you who don't know who we are, Spear is a private outpatient practice that has been around for over 20 years, and we currently have 20 locations located all throughout the New York City and metro area. Since the pandemic started, in addition to continuing to offer in-person care, we launched Spear Live, which gives you the opportunity to receive physical or occupational therapy treatment from the comfort of your own home in a virtual way. It's worth noting that most health insurances have asked us to waive our patients' copays, co-insurances, and deductibles for these telehealth visits. So if you've been putting off treatment, now is the time to reach out and get back on track. Within the clinic, we're going above and beyond the CDC guidelines and taking strategic measures to ensure everyone is safe and our environment is clean. Please see our website at spearcenter.com for more detailed information in regards to this. Since the COVID-19 pandemic started and our usual places of exercise had to close, a lot of people turned to at-home exercises and workout programs on their own. As a result, we've seen a large influx of patients reaching out to us with complaints of low back pain, as well as general questions about exercises for the low back while working from home. Our team of clinicians got together and agreed that given the increase in activity, it would be a good idea to provide you all with some tips on low back and pain prevention and how to address any symptoms you're currently experiencing. We created today's talk specifically for you and are coming to you live from our own homes. We don't anticipate any technical issues today, but please be patient with us as we navigate working through this new technology. As part of our session, we'll be demonstrating some exercises, and we really look forward to you following along and participating. I promise you, this will not be like your typical Zoom meeting. We're going to have some fun. Please note that if you're experiencing any pain while performing any of the exercises we demonstrate for you today, please stop and reach out to us directly so that we can support you. Just a little housekeeping. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. If everyone can hover at the bottom of your screen, you'll see a Q&A option. That is where you'll put questions, and we'll do our best to address as many of the questions as we can. For those of you who are watching through YouTube Live, we're monitoring the comments section there as well, so please feel free to type your questions in. So, moving on to our goals for today. Ultimately, we want to get you moving. We'll be demonstrating some exercises throughout the webinar that you can do to treat and diminish pain. George and Sarah are going to cover what makes up the low back and how does it function, what role does the low back play in posture and lifting, and exercises to support and prevent low back pain. So with that being said, I'd like to introduce our webinar team. So from our Chelsea location, we have George Padin. He's a physical therapist over on West 16th Street. From our 95 Chambers Street office in Tribeca, we have Sarah Shoemaker. She's a physical therapist as well. Helping in the background to answer some of your questions, we have Michelle Rooney, who's the clinical director and a physical therapist at our West 16th Street location in Chelsea. And you have myself. My name is David Block, again, Regional Director, Spear Physical Therapy. So with that being said, Michelle, Sarah, and I are going to say goodbye for now, and we're going to kick it over to George, who's going to start off this webinar.
Awesome. Thank you, Dave, and thank you for everyone for tuning in. So before we get into the movement part, I just want to talk a little bit about the anatomy and function of the spine. Now, at first glance, it seems like there's a lot going on with the spine, right? But once you understand the basic properties of how it moves, the treatment becomes pretty basic. All our spines are comprised of 24 movable vertebrae, right? So picture two vertebrae stacked on each other. They're all individual joints, right? They have the ability to shift forward, side bend, rotate. They could really do it all. And this enables us to bend forward, to stand, to do the things that we need to get done. A perfect example of this is someone who could do the worm dance move, right? They're using every joint in that spine to get their bodies up off the ground and back on the ground. Now, my spine's a little stiff. I'm not going to be doing that dance move if I'm going out at night, but I really appreciate the people who can do it. The point is our spines are mobile. Now, on the other side, our spines are also very strong. And when we talk about spine strength and spine resiliency, I think it's important to bring this slide up. I think you guys might recognize this person here. Yes, that is Shaquille O'Neal. So for those who don't know, Shaq, one of the greatest basketball players of all time, also one of the biggest basketball players of all time, weighing in at about 324 pounds. Now, the thing here is that if someone like Shaq were to tackle us, the average person with a average spine, we would be able to handle that blow without our spine fracturing. Our spines are strong enough to handle 2.5 times the force of Shaquille O'Neal. Now, I don't recommend you getting tackled by Shaquille O'Neal. That's not the point. The point is our spines do a great job at transferring this load throughout the spine in order for us to handle certain loads. All right, Shaq, that's all I got for you for now. Now, when it comes to prolonged positions, our spines aren't as great. So the idea here is we're fighting against gravity, right? And this property of impulse is what we're really fighting against. The idea of force multiplied times a certain period of time. So the longer we're sitting, the more that force gets amplified. Now, our bodies do great with a sudden impact. They distribute that force really well. Over time, we lose that mechanical advantage of our muscles, our tendons, our ligaments, and we start to experience more stress going to that back, which usually leads to more pain. So if we're going to sit for a long period of time, let's learn how to do it more efficiently, because at the end of the day, we have to sit, we have to stand, we have to do these things. So I'm going to cue Sarah in. She's going to talk about the core function and how we can really optimize our position here.
Thanks, George. All right. So like George said, this spine is very strong. But if the spine doesn't have our muscular support, we're going to get back pain. Think of the spine kind of like the mast on a ship. The ropes are the muscles that prevent it from curving or bending, becoming unstable. You're not going to be able to sail if you don't have those ropes. So if those supporting muscles or those ropes become too weak or imbalanced, the spine is going to experience a lot of stress, as if Shaq was tackling you. By strengthening these muscles, we can take the pressure off of our spine and reduce the risk of getting any back pain. So our spine is supported by our core. A lot of people think the core is just that six-pack or your kind of your six-pack, your abs that everyone wants to show off at the beach, but it's really a cylinder. So think a soda can, right? The top of our core is our diaphragm. The bottom is our pelvic floor. It's the muscles that support our pelvis, our bladder, help with bowel and bladder functions. The back is our spinal extensors. The sides and the front are our abdominals. They kind of wrap around, attach those back extensors, right? These muscles must all coordinate together to support our spine and prevent any sort of strain or overuse on that anatomy. For these muscles to really work efficiently, we have to have good posture. What that means, our head must be supported on our ribs, and our ribs must be supported on our hips and pelvis. If those aren't stacked appropriately, we cannot move efficiently throughout the day. So now that we kind of understand what kind of makes up that trunk, let's bring George back in, and we're going to go over how to find our neutral posture, especially in sitting, since we're doing that all the time these days.
Am I stacked correct?
Is that how you work all day?
Yeah, usually.
All right. Well, let's get those feet on the ground. First step. Because if we don't have a firm base, we can't build anything from that. So what I'm going to have you do, slightly turn sideways. There you go. Perfect. Everyone see him all right? Okay. What I'm going to have you do is kind of rock your pelvis back and forth, like you're going to really, really arch that back, and then bring it back like you're slouching. I may also want you to scoot back in the chair a little bit more.
Gotcha.
We're going to use every part of this chair to help support us. Good. So as you're rocking back and forth, I want you to slow that rock and kind of lessen the motion forward and back until you feel like you're really supported on your hips. Yeah. Right? You should sort of feel those sit bones that you're sitting on, but I don't want you just relying on them. So you should be a little further up. Good. So if you slid your hand behind your back, you should feel a little bit of a gap.
Yep, I got you.
Perfect. If we ever needed to adjust it, you can kind of add a little towel roll under there, but we don't want you overarching that you have a huge space. Okay. You should kind of always be touching something.
Makes sense.
Does everyone feel comfortable there? Great, because now we're going to stand. All right, George, come on up. We're going to do pretty much the same thing, but as you are standing there, I want you to put a hand on your stomach and a hand on your chest. So if we were doing a real assessment in the clinic, we could use something called a plumb line. What that is a line that you would draw straight from the floor up to the ceiling. If you had good posture, it would be able to bisect straight through your ankle, right through your hip, your shoulder, and your ear. If you looked at George right now and tried to put up an imaginary line, you would not get that at all. Since we don't have that line to draw, we're going to have George use those hands to help cue him. So George, try and rock your hips again like you did before. Bring your hand up a little higher. Good. Perfect. You're going to rock back and forth until your hands feel stacked on top of each other.
Feels pretty good right there.
Good. And head up nice and tall. Perfect. So if you looked at George now, you can kind of imagine a line went straight through his body and cut him in half. Good. George, you feeling all right?
Feeling great. Thank you, sir.
These positions, though, are not the end-all be-all. Like George said before, our spine has to get moving. These are more of a cue to kind of check back in with yourself throughout the day. Like maybe you're just sitting for 4 hours straight while you're working. The best thing to do is to kind of set yourself a reminder to check in and get up and move every hour. the next posture is the best posture. All right, so since we've been up and then sitting, let's start moving. All right, we're gonna have George now get onto the floor. We're gonna learn how to brace and activate that core. All right, George, you're good, we can see you. So we need to build that strong foundation. Just think, if you wanted to build a beach house, you're not gonna just start building it on the sand without a strong foundation. So we're not gonna be able to move around until we have that strong base. So George, keeping your hands right there on your hips, those two front bones, all I want you to do is try and flatten your back into the floor. You should also feel like you're pulling your belly button in towards your spine.
Just like feeling a little lightheaded.
All right, remember to breathe.
Oh, okay.
All right, so just because you're engaging your muscles does not mean you're sucking in and holding.
Gotcha.
All right, so laying there, all you're gonna do, we're trying to really engage that deep transverse abdominis muscle. All right, it connects to your pelvic floor, it kind of wraps around and gets those back extensors. All right, helps build that whole core. So to ensure that strong foundation, this muscle's got to be working. So as you're there, kind of, you should feel a gentle activation under your fingers as you pull in.
Yeah, I can feel that.
Good?
Yep.
Perfect. Let's hold for about 5 seconds and then relax. Let's do that about 2 to 3 times.
Gotcha.
Good. You're breathing over there?
Yep, still breathing, not as lightheaded. Feels better.
You're not turning any colors, which is good.
Awesome.
All right, if that starts to get easy, you can also add a march to it. You up for the challenge?
Let's do it.
Okay, so all you're gonna do, starting from the same position, gently pull that belly button in. You're gonna lift one heel up from the ground. Good, keep that 90-90 angle of your hip and knee and drop it back down. Good, now let's switch legs.
So much harder. Wow.
Yeah, so this is us trying to add that mobility to the stability that we're building.
I feel like my spine wants to move side to side.
Do you feel engaged enough in the core?
Oh, yeah. Obviously.
Remember that. There you go. Good. Give me about one more. Perfect. All right. How's everyone else's core feel? Now that we have it nice and braced, George is going to show us how to kind of do some lifting. All right. You got some boxes or anything, George?
Honestly, I don't have anything that heavy. Do you have anything that you could throw my way?
All right, well, all I really got is this bad boy, and this may be the only roll left, but it could also be the only thing you can lift. Is that all right?
I kind of hurt, but yeah, bring it on.
All right, get ready and catch.
Wow. Yeah, you were in line. That's pretty heavy. Thank you, Sarah, for that. So what we're going to do is going over how to lift something heavy like a roll of paper towels from the ground. Let me just position myself, guys, well here.
Hey, George and Sarah, just pop it in real quick. We had a question in the Q&A about how to find the bones on the front of your hip to do some of the core exercises.
Okay, George, are you already on the floor?
I am on the floor right now.
Okay, so if you kind of feel your belt line, your pants usually sit right above or at where those front hip bones are. They may feel a little pointy, and if you kind of rock your pelvis front and back, you should feel them move under your fingers.
Nice. And can you guys just demonstrate that in standing as well?
Yeah, sure.
Sounds good.
George, you go forward, I'll go sideways.
Gotcha.
Good, so.
Yeah, nice and easy. It's like you're right, emptying the bowl out and then trying to tuck the bowl back in.
Right, tuck it back in.
Very accessible. Nice and easy like that. Hope that makes sense.
Hope that helps.
All right, so on to lifting. Thank you for the great question there. So when you're trying to lift something, you want to make sure that object is right within your center of mass, right? So this is pretty heavy, right? So I want to make sure it's as close to my body as it can be. Now we're going to carry over Sarah's activation of our core, right? We still want to be able to find that core activation, right? Going inside to those hip bones, make sure we're nice and activated without holding our breath. And all we're going to do is get our hips down, make sure our chest goes over the object, and then bring the object up just like that. We're still staying engaged the entire time. And all I'm going to do to bring this back down is just get my hips back. You know, think about if someone were to punch you in the stomach, right? That's how your hips should translate backwards. That's all lifting is here, all right? So hopefully that makes sense, and hopefully you guys feel safer lifting heavy objects like a roll of paper towels. All right, let's bring Sarah back in. I want to show Sarah a few exercises here to how to support herself better when it comes to sitting.
Awesome. Yeah, what do you got?
All right, Sarah's back. So what we're going to do here, Sarah, let's go into an active child's pose position. So we're going to go on our hands and knees. And the reason why we're doing this here is to introduce the concept of load to our spine, right? When we sit, our spines take on load, and the same thing happens with this exercise here. So like your normal child's pose position, it's the same setup, but Sarah's just going to have her knees off the ground. So can you do that for me there, Sarah? Awesome. While maintaining that position with the shins nice and parallel to the ground, let's have Sarah translate her hips back and then forward. Awesome, just like that. Let's try that about 5 times there, Sarah. Now, if you guys are starting to experience a little more pressure in your knees, you may have to widen out your stance a little bit. Yes, you will feel your quads work, and that's okay, right? We are getting our legs involved. But we should feel like our spine's turning on. We should feel like we're pressing our hands away from the ground to get some of that upper back activation as well. Sarah, are we getting anything in the upper back there?
No, nothing.
What you may have to do is let's try to creep your hands a little more forward then and see if you can rock back a little more. And think of trying to almost split your yoga mat in half with your hands there.
Yeah, there we go.
There we go. Beautiful. So feel free to try that one periodically throughout the day. Now, the next thing I want to talk to you guys about is the hip. Now, when it comes to the hip, it really directly influences the spine. To get a better idea of that, let's bring in this slide here to show you what that really means. Awesome. Thank you, Nicole. So as you can see here, right, the hip actually really influences where the spine is oriented in space. Now, Sarah has a great model of the pelvis there as well. As we start to bring, right, our thigh up, as you can see here, right, as that thigh comes closer to your chest, what happens on the back end is that our low back starts to round. And that's just natural, right? That happens. But when we're sitting, and if someone doesn't really have a lot of that hip flexion range of motion, what tends to happen is we start to round earlier than we should in the low back. What that does is it sends more weight to the backside of our spine. It offsets the weight from our actual sit bones, and more stress goes onto that spine, which can lead to pain down the road. So in order for us to open up that hip a little more, I'm going to have Sarah go over this exercise here. So let's get this slide out of the way here so we can get Sarah back in. Awesome. So Sarah, we're going to do a quadruped posterior hip capsule stretch. So we're going to go back on our hands and knees, and let's target the right side first. So what we're going to do is we're just going to tuck our right shin underneath our left. Amazing. And what we're going to do is translate our weight to the side. So to the right side, you should feel like your awesome shoulders and hips go back, and then you lean back right there. Sarah's feeling it in the glute, and that's exactly where we want it. Now, if you guys are feeling it more in the hip, you guys might be going too far into it. Right? The key is to feel that stretch right in the back of the glute to really open up that hip. Sarah, let's hang in there for maybe like 5 more seconds. And then we're going to try the other side. You still feel it there in the back of the hip?
Yeah.
Awesome. Yeah, the key with this, guys, is really shifting the weight to the side and then translating your weight back. Awesome. And as you do this kind of more, you will get more flexible, and hopefully sitting feels a little bit more comfortable for those that have a tighter hip. All right, Sarah, you have anything for me?
Yeah, so now that we've kind of went over bracing and how the hips are involved, I want to now go over the patterns of our spinal mobility. All right, so we're going to go over a cat-cow or a cat-camel, like George likes to call it. All we're going to do is come onto our hands and knees. All right, if anyone's knees are uncomfortable in this position, toss a pillow under there, a towel, just a little cushion. All right, what we're going to do is you're going to first have a nice even stance. You're going to try and round your back up. As you're rounding, George, I want you to drop that head between your arms.
Gotcha.
Good. So here, you should also exhale as you're in this rounded position.
Got it.
Now, slow, drop your spine and belly towards the floor, and head looks up. Good.
This is sadly making me sweat.
All right, let's do that 2 more times. Good. Nice. Always keep a nice strong base with those elbows straight. Perfect.
Gotcha.
Come on up. Good. Remember to breathe. Nice. You should also remember there shouldn't be any hip rocking back and forth. You want a nice stable base.
Yeah, these feel great, Sarah.
Nice. Yeah, especially if you sit the way you sit.
I'm trying to be better.
All right, give me one more, and then we're going to move on to kind of work on that stability with dynamic mobility.
All right.
Nice.
No.
All right, so we're going to stay in that quadruped position.
Gotcha.
You may either, move stuff out of light or move long ways. Perfect. So now what we're going to do, it's called a bird dog. You kind of look like a bird flying and a dog right now. What we're doing is keeping that core nice and engaged. So George, belly button towards the spine, but remember, don't suck in as if you're holding your breath.
Gotcha.
That's just going to keep your spine neutral throughout. Now you're going to lift one arm and the opposite leg. So if you lift right, lift left leg until they feel nice and parallel. Good. Keep that head looking down towards the floor. That's going to keep your spine nice and even too. Hold for about a second or two. Come on back down and we'll switch sides.
Was that the prettiest bird dog you've ever seen?
You definitely sat on it a little. Good. Way to take your time into the motion. The biggest thing with these is to keep those hips level. So George, if you take that heavy paper towel roll I threw you, you can place it right on your low back.
Gotcha.
All right, and see. Good.
You want me to try with this on my back?
Yeah. So the goal is to do it without the roll moving. At home, if you can use a pillow, a broomstick.
Feel it moving.
Yeah, but it's good. As long as it doesn't fall, I'll count it.
Got it.
Good. Give me 2 more.
Oh, almost lost it.
These look really good though.
Thank you, Sarah. Great coaching.
It's all that bracing you're doing. Yeah. Nice. Perfect. All right. How you feeling?
Feeling pretty good.
Okay.
Do you want me to show you a few more things to help with standing here?
Yeah.
Awesome. All
I
right.
don't have to sit around.
All right. So kind of like what we said before, right? our hip position directly influences where our spine is in space. So if we had been sitting for all this time and we start to stand, as we sit for longer, our hip flexors, right, are the muscles that cross the front of our hip and they directly attach to the center of our spine. Imagine, right, Sarah, if I'm trying to get up, but I've been in this position all day, these muscles adapt and become shorter. So we want to make sure we're stretching out this nice hip flexor so it doesn't pull on our spine as much.
Right, because then there goes our posture if you're leaning over like that.
I know, I do have tight hip flexors. Thank you for calling me out here, Sarah. So what we're going to do here is we're going to drop on one knee. And I want you to get in a nice half kneeling position. Amazing. So in this position, what Sarah's going to do is she's going to try to first engage her core and flatten out her back. And then she's going to squeeze her butt muscles together, her glutes together. Imagine that there's $100 bill between your butt cheeks. Don't let it go. All right? You got it, Sarah?
I don't have one. Do you have one?
I'm not giving you one, so you got to work with what you got.
All right.
But with that in mind, I want you to keep that activation, slightly lean forward without arching your back. Awesome. Now, can we feel that pull at all?
Yeah, right here.
Amazing. Now, Sarah's doing an awesome job of not arching out her back. Now, as soon as we arch, we lose the tension in the front part of our hip. There goes the stretch, a waste of time. Now, the key is, right, to stay nice and stable, holding for about 20 to 30 seconds. Sarah, how are we feeling there?
Good. Good.
Awesome.
So when you mean arching your back, you mean this not happening, right? You don't want me coming here, any of this, any of this.
100%. That would be the worst thing you could do in this situation.
Okay.
Did you switch sides there?
Yes.
Nice. All right, let's get a good hold here, guys. Let's hold for about 20 to 30 seconds, really keeping those glutes engaged. And right, you can stretch all you want, but the next thing we're going to do is teach her muscles how to activate in that position, right? We have to build some muscular support so our muscles know what to do when they get in that position. So Sarah, we're going to go over some bridges here. Do you mind getting on your back for me?
Sure.
Awesome. So now we're going to activate our glutes and try to make them a little stronger in hip extension. So what Sarah's going to do is she's going to find that core position that she taught me. Sarah, can we find it there?
Yep.
It's good. Make sure we're breathing. And what Sarah's going to do is think about engaging her glutes, keeping her spine stable, and lifting her hips right off the ground. Let's have Sarah try that about 5 times.
Am I using that imaginary $100 bill?
Well, you don't have one, so think of whatever you got. But yes, for those who do or have lighter change, think of that there. Nice. And Sarah does a great job of not letting her spine over round or over arch, right? It should feel like a pure hip motion. It shouldn't feel like a spinal rounding or spinal arching movement. That looks great. Let's try maybe 2 more there, Sarah. Awesome. And for all those of you doing it out there, make sure we're breathing, make sure we're feeling our glutes. Now, if we're feeling our back kick in too much, we might have to bend our knees so our heels are coming a little closer to our hips, and we may have to widen out our stance a little bit more. Now, Sarah, give that a shot. It might feel a little harder to do, but it should feel a little less stressful on the back there.
Much better.
Awesome. Sarah, you're a rock star. So those few things there should really help you support yourself while you're standing. We went over some things to help you guys sit more efficiently. We went over lifting, we went over posture, we went over alignment. So hopefully you guys feel a little more educated when it comes to your back and putting your back in these types of positions. And Michelle, how's the Q&A looking there?
All right. Sarah and George, I'm feeling it in my hips and my back, my glutes engaged. You have some great questions in the Q&A that I'd love to throw back at you. So one of the first ones we got from an anonymous attendee, it says, you said to keep the little space curve in your back when you're sitting, standing, and doing exercises. Why then, when you're doing exercise on the floor, do you say to avoid that space being there?
So when we recommend flattening your back, you still should have a natural curve of your spine. Your spine is an S-shaped. So when we say to flatten your back, it's just the cue to kind of help you imagine you bracing your core. All right. You shouldn't feel like it's rounded or you're doing kind of the cat motion that way. That means you're over rounded.
That's great. Thanks, Sarah. Sometimes we had a question from, I can't say that, so I'm not going to. Sometimes I get pain behind my knees when I extend in bird dog. What does that mean?
Go for it, George.
Yeah, I mean, it could be a few things. You might be kind of overusing some of those backside muscles and may not be engaging your glutes enough. So for that case, I maybe would limit your height with your bird dog so you start to build a little more endurance and strength in that hip extension position. You may have to honestly work on your bridges and build up that a little bit more until you start hitting that bird dog there. You also might benefit from bending your knee in your bird dog and doing a pure hip extension lift to see if that eliminates any hamstring tension there.
Yeah. And a follow-up on the bird dogs, George. With the bird dogs, how long do you hold each arm and leg?
It honestly depends what you're trying to train, right? If I'm someone who's standing for a longer period of time throughout the day, I might hold that position for longer, maybe 5 seconds at a time, maybe 10 seconds at a time. If I'm someone who's constantly moving throughout the day and just needs a little more quick stability, I might hold that position for 2 to 3 seconds. So it depends on what you're doing throughout the day, Dave.
Nice. Okay, we got another question from Vita. Are those back exercises okay for someone who had back surgery?
I would want to be cleared by your doctor to ensure you don't have any precautions or contraindications you have to follow. Depending on surgery, there's strict guidelines that we have to follow in rehab. So if you are interested, we're available to help kind of go over what is safe and what is not safe.
That's great. Okay, next question. Do you have any advice for sitting for a long time if I don't have an office chair?
So it'll depend on what chair you're sitting in, but I typically tell my patients, friends, I'm sitting in a very plain chair. So I would usually say less is more. If you have a chair that you kind of get into this 90-90 position, or I'll show you what mine looks like. I literally just sit in a normal chair and I stick a pillow on it. So as long as you can just get that upright posture, you can always add pillows, towels, blankets behind your back to kind of get a natural lumbar support. But it's really kind of trial and error until you find a comfortable position.
And then going off with sitting, Leslie has a great question. She says she always starts out with correct posture in her office chair, but she finds herself slipping forward on the chair. Is that her or is it the chair?
Yeah, I mean, that's a great question there, Leslie. It could be a little bit of both. And a lot of times that's influenced by your feet as well, right? Are your feet really grounded to the ground, right? We should have some weight through our legs as we're sitting down. So you may have to check, are your feet actually taking on some load and are they stable? And are your feet shifting forward? So I would say kind of look at that from the ground up and see if that helps.
We have a few more questions on bird dogs, so I want to touch back on those a little bit. So a couple of questions about people with some other injuries. So Ronnie wants to know, he has carpal tunnel syndrome. So how does he hold a bird dog position without exercise on his wrist? We had another question about bird dogs for people with knee pain. So if you guys want to maybe tackle both those at the same time. The last question I see is someone gets popping while they do extend their legs back. And what should they do? So knees, hands, and some popping.
So with the hands and your wrists, we want to protect your wrists at all costs. They are not huge weight-bearing joints like our feet and our legs are. All right, so they're not supposed to take a ton of load like the rest of our body. So what you can do is simply, instead of putting the weight through your hands, come on up on your wrists. And then it'll be in a nice neutral position instead of that force going through this way. All right, you may be a little uneven, but that's okay, as long as that back is nice and straight.
And then you said knee pain and popping, right, Dave?
Yeah, so if they have knee pain from kneeling while doing the bird dogs or some of the other exercises like the half kneel, hip flexor stretch, and those types.
Gotcha. So for people who have, pressure sensitivity on their knees, you want to cushion that up as much as you can. say you've found everything in your apartment and you still can't get some relief, you could totally do something where you're sideline and you're just working, one side at a time, right? So you could just minimize the impact by just playing around with your position. And then in terms of hip popping, when you extend the leg out with bird dog, sounds like it might be coming from a little bit of hip tightness, but you may just have to work on mobilizing and stretching out that front part of your hip so you have a little more hip extension, so those mechanics of that hip joint work a little more smoothly for you.
Right.
Awesome. We have another question shifting back to office chairs a little bit. Do you guys have any cushions or lumbar supports that you would recommend for somebody's office chair?
I'm not one to recommend strict brands because there's so many out there, and it's really going to depend on what you specifically need. But you don't want anything that's too cumbersome or that has too many gadgets on it, because you can't take away as you can add extra support.
It's great, Sarah. We have another question on sitting and posture. One of our attendees wants to know about exercise ball chairs and what your thoughts are on those.
So I'm all about sitting on a physio ball while working, because you're getting that core to engage and keep yourself up. I just would not recommend sitting on the exercise ball all day long.
And just to add to that, you got to make sure of the size of the physio ball too, right? If you're a bigger person and it's a really small physio ball, you're going to be in a crouch
All
position.
scrunched up.
That as you try to experiment that out.
It's great. I want to acknowledge we're getting flooded with questions, which is awesome. We're going to do our very, very best to get to all of them. And if we can't get to them right now in the time constraints of the webinar, we'll do our very, very best to get back to you. There's some great questions coming in. I just want to make sure I acknowledge that for everybody. So we have a question from Erin. She wants to know, her back is really, really stiff and painful first thing in the morning when she wakes up. Do you suggest doing these exercises first thing in the morning to loosen up your back?
Yeah, definitely. It's a nice warm up to get yourself moving, especially those cat cows are gentle enough that you're not going to start building up a sweat or anything. So definitely try them as soon as you get up, because another reason, they're now done for the day. You don't have to worry about exercises for the rest of the day.
Yeah, it's great. We're getting a lot of questions about sitting cross-legged while sitting in their chair and if that can impact back and hip pain. I'll let you guys, it's kind of general, just take it from there.
Yeah, kind of what we were touching on before, right? We want both our feet to absorb some load and have us be stable from the ground up. So if we're putting ourselves in a cross-leg position, especially for someone who doesn't have great hip mobility, we might start to slump in our back a little sooner than expected. So try to really force yourself to those feet on the ground. Now, for a few minutes at a time, great. But if you're there for 20, 30, 40 minutes, you might start running into some issues.
Yeah. So a couple demonstrate questions that I think will be great. We can definitely take a few more. So the first one is, can you cover how to get down to up from the floor safely with back pain?
Yeah. George, you want to walk me through it?
Yeah, I could walk Sarah through it. All right, so let's start maybe grounds. Are we going standing? Let's go ground up.
Ground up.
All right, so Sarah is in a sitting position. We want to do this the most efficient way. Now, you don't have to do this, but if you're suffering through some back discomfort, let's go through this way. So Sarah's sitting. What I want Sarah to do is try to get on her hands and knees. Nice. Way to rotate your hips. Awesome. Now from this position, what she could do is get one leg up. I would probably get your stronger leg up. You could put your hands through your thighs and try to really lean forward and push yourself up with that leg there. Now, if that becomes too hard to do with just using your hands on your thighs, bring a chair, bring something nearby to create some leverage to push yourself up there. And Sarah's just going to demo that one more time. Awesome. She has her chair. Boom. Always lead with the strong leg.
Good. Do they want floor to stand to floor?
Yeah, I think that'd be great.
Awesome. All right, so say you're standing there, Sarah, and you could kind of do the same thing. I would honestly bring the chair over And what you can do is just kind of reverse that position, right? If you're head on the chair, just take a step back with the leg. Easy. Nice. Bring the other knee, go onto your hands and knees, and then you can rock and roll from there.
All right, awesome.
Yeah.
We have another good question regarding like posture. Somebody asked, what's the right posture for their low back while walking?
So similar to how we found it in standing, you want to make sure you're stacked. You're going to be using a lot more hip extension while walking. So you got to remember to really engage that core. You have to be really conscious about it. And then when your leg's behind you, you want to squeeze that glute as it gets back there. Once that becomes really conscious and you're very aware of it, it'll switch over to become a subconscious motion.
That's great. All right, we got a question from Hal. How do you avoid quad stiffness when sitting for a long time?
The hip flexor stretch.
Yeah, Sarah nailed it right there. Just periodically doing your hip flexor stretch, and if you don't like getting on your knees, you could even do it right in standing, just getting those hips forward without arching your back. But that's going to be the biggest thing, just periodically doing that hip flexor stretch out.
Awesome. Back to another chair question. They don't want to know about the specific lumbar support type, but would you recommend a lumbar support in someone's desk chair normally if they have no pain or if they have pain?
If you don't have pain, no need to add anything. Your posture is you're probably pretty aware of how you need to be sitting in the chair without anything else. If you have pain, I'm not going to say yes, because it depends on what kind of pain you're having and what's really causing the pain. But if you feel like there is a big gap between your back and the chair, try to add a small towel to kind of offload.
All right. Awesome. All right. We have another question coming in from Joanne. Can you guys address the proper cadence when you're working at a desk for how long you should be sitting and how long you should be standing for what periods of time?
Yeah, I always tell my patients, and I do myself, set an alarm every hour. Because if you were sitting all day long working, if you were in the office, you'd probably get up, go to the bathroom, go get a cup of coffee every now and then. But if you're at home, you're probably pretty close to everything that you don't get up as often as you work. So I always set a timer on your phone every hour, and that'll be your cue to get up, take a few laps, even if it's a few steps throughout the day, up around the house, sit back down, you're good to go.
Awesome.
Do you recommend anything else, George?
No, that was well said. That was great.
You guys are in sync today.
Yeah.
All right. So we have a question here from Steve. He wants to know both of your thoughts on standing desk.
Steve, what's going on, man? So it really depends, like what Sarah said, it depends on what you are doing. I think if you're someone who's sitting all day, I think a standing desk is a great alternative, but you don't want to go to standing all day, right? So sometimes I tell my patients who kind of favor sitting but are contemplating that standing desk, maybe consider a 2-to-1 ratio from sitting to standing, just so you can expose your body to standing a bit more, but I don't want you to overdo it either. So it's a balance between the two, but definitely something to consider if you're experiencing some discomfort.
All right, that's great. Thanks, George. We're back to bird dogs. Bird dogs seem to be the popular one today. We have a question from Liza. She wants to know if one of your shoulders is weaker than the others, are bird dogs okay to do? And if so, are there any other ways that they could do them if they have a weak shoulder?
So if it's not causing pain in your shoulder, I would say it's okay, but limit the amount of reps you're doing. Kind of back it down a little bit, but you don't have to cut them out completely. If it's too much on your shoulder, you can do what George did before, laying on your side and kind of doing the same motion, just eliminating the risk of the weight bearing through the shoulder. All right. Just like that.
Awesome. Thanks, George. Great demonstration, as always.
Thanks, Dave.
We got a question from Kelly, and then I think we're going to take one more question after this. So Kelly wants to know if a Peloton or any other type of spinning could be contributing to some back pain that she might be experiencing or people could experience.
Yeah, thanks, Kelly. It definitely can. you may be rounding your back too much as you're sitting on the bike. The bike seat height can also play into it. If you don't have a stable enough, kind of that hip hinge George went over, then this can be happening too much as you're biking, putting too much pressure on your low back. So kind of reassess how you're sitting on the bike and see if that helps.
That's great, Sarah. We're going to take actually a couple more questions. I was told we have a little more time, which is nice. There's a question on sit-ups. What are your thoughts, Sarah and George, on sit-ups and low back pain, if you have any?
You said sit-ups there, Dave?
Sit-ups, yes.
Great. Yeah. So, I mean, the sit-up is a great movement because we have to sit up in daily life. But if you're someone who is experiencing discomfort with sitting, you can do a modified sit-up. So if you are trying to get your sit-up strength up, right, the key is to really think about connecting your ribs towards your belly button and trying to really think about that motion to start with just lifting your shoulders up, right? You don't need to go full on right away. So that's a nice way to build up your sit-up strength. And then another add-on to that, as you get a little stronger, you can just work on the eccentric part of the sit-up and then help yourself get up on the concentric part, all right? So just something that you can progress to as you get a little stronger then.
Yeah. All right, and we're going to take this as our last question for now, and then we're going to wrap up. And like I said, we're going to do our best to respond to all of these individual questions. There's so many good ones coming in. We have a question from Jake, and this seems to be a theme in a few of them. That's why I'm trying to throw this one in for the last one. A lot of people are asking about their pain throughout the day, and a lot of people are saying, why is my back pain worse first thing in the morning? Is it the sleeping position? Does it have something to do with back pain? I'll let you guys take it.
So pain early in the morning, typically from prolonged positioning. Like we're not sleeping for just an hour, whereas you would get up if you were sitting at your desk. So that prolonged positioning and those muscles are now getting a little tight because they've been stuck in the same position for 6, 7, 8 hours at a time. So it would be good once you get up, kind of do some of the cat-cows, go for a nice little walk, kind of warm up a bit. It's just you've been laying for too long, typically.
Yeah, and just to touch on that, you just got to be mindful of what you're doing the day before too, right? If you did a lot the day before that you're not used to doing, you might wake up a little stiff. Also, if you were sitting all day the day before, you might wake up a little stiff the next day. So take care of your body, maybe do a little light motion even before bed. Make sure you're hydrated to take care of the soft tissue in your body and see if that starts to help as well.
All right. Thanks so much for answering all those questions, Sarah and George, and thanks to everybody for some awesome questions. So we hope today's talk was valuable and that you learned a few ways to prevent and perhaps manage some symptoms of low back pain. If we didn't get to your question, as I said before, we'll do our best to reach out to you directly afterward. For all the people asking about pain with specific things, my advice to you would be to consult with one of our physical therapists and we'll be able to assess your individual needs. On that note, if you'd like to reach out to us to schedule an appointment, here's our contact information. As an orthopedic outpatient physical therapy practice, we treat an array of conditions from head to toe. Should you feel you could benefit from some individualized guidance and treatment, please don't hesitate to reach out to any of us individually. You can see our emails all there. We will personally coordinate you being set up with one of our team members for an evaluation. As a reminder, we're open for in-person visits as well as for telehealth sessions. For telehealth visits, most insurances are waiving your out-of-pocket expenses during the COVID-19 pandemic, so please reach out to us today and we'll get you set up for treatment right away. Our goal is to get you back to life. Thank you all very much for spending time with us today, and be well.
Bye.